All right. Okay, we're going to get started with our next presentation. Please welcome Ms. LJones.
I'm Leanne, and I base my project around technology and EMS. My interest in EMS came strongly from my family. At one time, there were 4 generations of Jones in the rescue squad. Pictured here is my great-grandmother in the middle, and my grandfather and my aunt, my great-aunt. I joined the rescue squad and became an EMT when I was 16, and I began running calls right away. After running on the rescue squad for about a year, I'd worked with all of the equipment, but I wasn't really sure how well it actually helped the providers and the patients. So I wanted to find out the efficiency of the technology that we used on the patients and how it helped us too. So I started my internship with Madison EMS. My supervisor was Lewis Jenkins, pictured over there. I couldn't run calls with him, so I spent a lot of time with this crew, Stephanie, Catherine, Jordan, and Billy. And in that picture, we were actually doing some training I was helping them with. Of course, since I wanted to go on calls and learn how the equipment was used, we only had 1 call, and we didn't get to transport them. So I helped them do their chores and help with their training. And I talked to Billy and Jordan the most about which technologies I wanted to focus on. So I decided to focus on 3 technologies, the first being the Stryker stretcher that we use. Its battery-powered hydraulic system helps us to load the patients, and it reduces provider back injuries by almost 60%. So that results in a lot more staffing for ambulance services, so we can better help you. Next, the LifePak 12 is a monitor system we use on every call. We check patient vitals with it. And in some instances, when we are concerned that you may have a cardiac emergency, we will hook you up to an EKG, and it reads the electrical signals in your heart, and it states in plain English when it prints the report out, whether you're having a heart attack or not. If you are, then all we have to do is press that yellow button, and it will send it to whichever hospital we are transporting you to. And they will have a team ready when we walk into the hospital doors. So that impacts the efficiency of the patient's care when they get to the hospital, which is really important in any kind of cardiac emergency. And it also helps us because we can set a timer to take your vitals for every 5, 10, 15, or 20 minutes. So that frees us up to help the medic give you any kind of drugs that will make you feel more comfortable or help your situation. The Lucas is the last and I think the most important. This device is used in every CPR situation. The only patients that it cannot be used on are bariatric patients and children because it will not fit. It's a mechanical device that does the compressions for the providers, and it provides continuous flow to the vital organs such as the brain. A study done in Georgia, they had about 20 nurses do CPR for 15 to 20 minutes, which is the normal CPR time before somebody would consider calling it. And the nurses got fatigued after 45 seconds to a minute, and they were not able to get the textbook definition depth for the blood to flow to all the vital organs. So this helps a lot with that, and it also reduces provider injuries in the back of the moving ambulance, because if you're in the back of the moving ambulance, you have to stand up to do CPR with your elbows locked. So that could create a potentially dangerous situation for you, the provider. So I did my community service at Graves Apple Festival, or the Fall Festival. We were out there for 3 weekends selling raffle tickets. My mentor or supervisor for this was Stephen Dodson, and those are a couple of the volunteers that helped me sell the raffle tickets. We collected $2,930, and since it was a 50-50, half of it went to the winner and half of it went to the rescue squad's building fund. for their new building. So the significance or legacy of my community service, I donated the money to the building fund for the rescue squad, and it's going to be located on 29. So we'll have better access to both ends of the county, and we'll be able to have a faster response because we'll be directly on the main road. So my advice to other people who are going to do this is to start early. I started in the summer. I started my internship over the summer, and it greatly decreased my workload during the school. So, and then always have a plan B. Fortunately, I didn't have to use my plan B, but I did have one. So this project, along with my other 3 years in governor school, has helped me grow in 3 different ways. I've grown professionally by communicating with the adults that I needed to interview and set up appointments with, and I've grown as a leader. I led about 30 people for the fundraiser that I did this year, and I organized the times and dates, trying to get all of the ambulances out there at the right time in the right spot. And I've also grown personally because I gained a lot of self-confidence that I needed to pursue my career in nursing. And I know that the lessons that I've learned here are going to take me far in my career. So thank you to everyone.
How do you decide when to use the compression machine? Are you in contact with the hospital at that point? Do you know?
The Lucas that we track across the
I
street.
couldn't remember the name.
Well, if we're toned out for a CPR in progress, the first thing that we're gonna grab before we even get on the ambulance is the Lucas device out of the side compartment, and we're already gonna have it set up for you. So, I mean, nobody really tells us when to use it. We just use our best discretion.
Oh, okay. So you can go ahead with that,
Right.
permission from anybody.
Right. We have a standing order to use whatever type of materials we need to from our medical director. So.
The volunteer squad is diminishing all the time. And what do you think the answer to that is, or what?
Well, I'm really hoping that all of the funds that we're raising for this new building is getting the word out there that we do need volunteers and we do need help. Actually, right now, last night actually, I sat in on the new EMT class, and we have a couple coming up that I think are going to be great additions. And I just hope that the new building project is going to really get the word out there that we do need help, and I hope that it's going to help us continue operating as a volunteer rescue squad for many more years.
Did you find anything out about the lifespan of this technology? Is this the type of thing that's changing rapidly, and you buy a laptop or phone and 6 months later they got the new version out?
Right, right. The medical field is definitely not a static field to be in. It's always changing, and we're always getting all kinds of new technology. But in a community as small as Madison, with the funds that we're allowed to go on, we of course don't have the top, brand new. But as newer technology comes around, we do eventually get the best possible.
And I'm just curious, what was plan B?
My plan B was to probably go somewhere in Orange or Green and try to get an internship there. They also have rescue squad personnel that would be willing to help me with that. Yes, ma'am.
I see you're wearing your EMT outfit, which I really like, but I noticed that you have scissors in your pocket. Is that part of your uniform?
Mm-hmm. It's just another tool in our toolbox to help. They're called trauma shears, and if you're in a serious trauma, we have to, it's called trauma naked. It's what we learn in class. So we have to strip you down completely to be able to diagnose you properly.
Are the problems all solved in locating a patient now? GPS and so on?
Yes, Mr. Finks at the 911 dispatch center made it very clear that he wanted all of those problems solved immediately, and they have. I mean, they can tell us if we've missed a driveway by 100 feet. So
Because people had hung on to their landlines for a while, and now it's not necessary.
no,
Correct. Very nice.